Welcome everyone to this session on mistletoe therapy. Today at Art of Healing Cancer, we are having a conversation with Abnoba, Germany, which is a leading manufacturer of mistletoe therapy. In our esteemed guest today, we have Mr. Mikhail Barkov, who is the CEO of Abnoba, Germany, which is a leading pharmaceutical company manufacturing mistletoe therapy. With us, we have Dr. Mandeep Singh Malhotra, who is the Chief Mentor at Art of Healing Cancer and a leading surgical oncologist based out of India. We have Mr. Anup Lohia, who represents Abnoba in India. So welcome everyone for this session. From here on, I would like to pass on the conversation to Dr. Mandeep, who would moderate the session and will have a conversation with Mr. Mikhail Barkov. Dr. Mandeep, over to you.
Thank you, Arpan. So as today's context is that we want to learn about mistletoe therapy, since as oncologists, a lot of us have heard about mistletoe. Some of our patients actually do use mistletoe, and today actually we wanted to learn from Mr. Barkov that what is the science behind mistletoe, what is the best use of mistletoe, and how do we can get this mistletoe therapy for our Indian patients. And let's hear from Mr. Barkov about mistletoe. So over to you, Mr. Barkov. Please start.
Yes, I will start. Thank you for this introduction. Abnoba was founded in the 60s, 1900. And even though it is a middle-sized company, it is a research-based company, and our main product is Abnoba Viscum. Abnoba Viscum is a mistletoe remedy. Here you see a mistletoe plant growing on a birch tree. And one interesting thing of this plant is that it is growing in every direction. Not only to the sun, it is as well growing to the earth, to east and west and wherever. And the product we made out of this plant is this. You can just see it. And my presentation is made together with Professor Dr. Roman Huber from the University Hospital in Freiburg, and from me and our research department. On the right side, the picture shows the building in which Professor Huber is working. On the left side, that is the seal of the rather famous University of Freiburg. You see, it's a rather old university compared to other universities in Germany. What I want to talk about is the cytotoxic effects of mistletoe, the immune modulation properties of mistletoe, how mistletoe enhance the quality of life. Then I will like to take a short look at cancer-related outcomes of mistletoe and how to start therapy. Let's start with cytotoxic effects. Cytotoxic effects here shown on several cell lines of lung cancer cells and stomach cells. Here you have the concentration of the mistletoe, and here the total percentage of the cells. And you see, the higher the concentration, the less you will have cells. There will be necrosis and apoptosis. We will talk about that later as well. So there is a cytotoxic effect of mistletoe remedy. the same. This is a lectin-rich mistletoe. The same you can see as well in a lectin-poor mistletoe. You see, the more you put mistletoe on the cells, you will see there will be apoptosis and necrosis. Here you can see it in a mouse xenograph. These mouses were treated with mistletoe and they have had human pancreatic cancer. This line shows the control group without any treatment. This line shows the group which got gemcitabine. And this line shows the group which got apnobaviscum fraxini. So what happened? In the beginning, gemcitabine is much stronger. But after a while, gemcitabine has no effect on the tumor. What we see with apnobaviscum, in the beginning there is a growth and then it is going down and down and down near to nothing. 3 of these 8 mouses have got complete remissions, the other 3 partial response and only 1 no response. That means on the long-term side, Apnoba is more effective than gemcitabine in this mouse pancreatic cancer xenograph. Why it is growing in the beginning? There is a so-called small enhancement always in the beginning of the treatment, and then you see there will be a cell death until near nothing. So, cytotoxic effect of mistletoe. The main ingredients which are responsible for the cytotoxic effects are lectins, and they induce apoptosis, and the other ingredient is viscotoxins, which induce necrosis. This is a picture of the lectins. And here I want to show you in a rather, let's say, impressive short film how necrosis and apoptosis work through if we put them together with mistletoe lectins. What you see here is the cell and the Golgi apparatus, and the red are the lectins. And this is done from the university in Netherlands, Den Haag. And we will soon see what will happen. 20 milligram of mistletoe put on, and what you see here is the lectins, red, apoptosis green, and the cell is blue. And the same with colon cancer cells. And you see the apoptosis is rather big, and it will grow even bigger. There are no cancer cells left after treatment with Abnoba viscum. So, cytotoxic effects in vivo. That means I just want to show you a case report, which is rather impressive, of a skull metastasis cancer. Here up you see the picture, and here you see the cancer in skull. And this lady was 68 years old, and she got several chemotherapies. And in this stage, after 3 months, we started with Abnoba viscum fraxini, 100 milligram intralesional. So, and what happened? This is once more a picture of you see it's rather big. This is in centimeters. This is a radiograph. And that is after 3 months. And this shows that the cytotoxic effect is not only shown by xenografts or something like that, it is even shown in human being. I will show you more. Chemical chlorodasis using mistletoe extraction. 62 patients with malignant pleural effusion, 90%, no, nearly 80% complete response. So here you see the blue one is before treatment and the red is after treatment. No symptoms in pleural effusion after treatment. Dyspnoea nearly gone. Cough has as well really gone. Pneumonia is as well gone. Sleep, no, this is not let's say, not that remarkable. But these two are rather remarkable during the treatment of pleural effusion. The next is bladder cancer trial. This was a bladder cancer trial, and the patient got the mistletoe direct into the bladder, and they got a complete remission of 55.6%. That means this is comparable with a chemotherapy. Here it is written, the recurrence rate in our study corresponds to lower range of the rate expected in the literature. So this complete remission is rather remarkable because it was a dose escalation study. So if we talk here about 55.6% of remission, even the small doses are connected in this picture. I can send you, if you want, the literature. So what are the cytotoxic effects? Cytotoxic effects mainly depend on the content of mistletoe lectins. They are mainly induced by apoptosis and can be clinically observed after intratumoral injection. Here, if we look here, we have 4 different mistletoe preparations. And looking at the lectin content, we see easily that Abnoba has more than, let's say, the 14th of what other have. 15 nanogram, 1,500, 1,600, and Abnoba 14,000 nanogram. In Abnoba viscum fraxini 20 milligram, which was as well used in this clinical study as well in the other clinical study I showed. So, what is the next? Mistletoe preparations have immune modulating properties. The first, what you see is after injection, after a subcutaneous injection, you will have a red skin reaction, which is itching. But that will last for about 1 or 2, maximum 2 days. And the immune modulating effects are shown here. You have apoptosis, you have a growth of monocytin, granulocytin, NK cells, lymphocytes, T lymphocytes. You get a DNA stabilization. You get a growth of T lymphocytes, B lymphocytes, NK cells, granulocytes, monocytes, and monographs. So that is rather a large range of effects. This shows, I don't want to go into details, but this shows the way, the mechanism, how it works. Now I would like to show some parts of that was what was shown here for the leukocytes. Here you have a chemotherapy without mistletoe. Here, the chemotherapy with mistletoe. And you can see these are the different time places. And you can see the leukocytes are not going down that strong as it is shown here. So mistletoe has a positive effect even during chemotherapy. Chemotherapy can be done more strictly because of mistletoe. The next is mistletoe enhance the dendritic cells. Just the same. So what we have is immunological effects of mistletoe preparations are mainly depending on the content of mistletoe lectins as well, only after parenteral injections, not after oral administration. Some companies offer oral mistletoe. Mistletoe, especially mistletoe lectins, will be destroyed by the stomach. So what is important? The parenteral injection, subcutaneous injection. Now I would like to talk about the quality of life. Most clinical trials are showing a very positive quality of life. Here you see chemotherapy breast cancer patients in a placebo-controlled multi-center study. And here are feelings of anxious, nervous, loss of hair, and all these symptoms are going down. The next is as well a clinical trial, breast cancer patients, global health status is significant better, physical functions significant better, role function significant better, emotional function, cognitive function, social function. That is rather an impressive result. You see, here are the different visits during chemotherapy. The next as well about quality of life, global health status, significant better. Nursing and nausea and vomiting, significant better. Diarrhea, significant better. That is as well an unusual way of the illness, and you can reach this impressive results with Abnoba Viscum. Conclusion 3 is significant enhancement of quality of life in observed frequent tumor entities, and normally we can say if Mistletoe are started before chemo or antibody therapies, the effect is even better than if you start during chemotherapy or after chemotherapy. Now I would like on the situation of clinical trials. There are about 36 clinical trials about survival. 17 show significant better survival, 14 show a trend, 5-0, no negatives. Disease-free survival. There are 10 clinical trials. 5 show a significant better disease-free survival. 1 shows a trend. 3 show nothing. 1 show a negative trend. Remission. 6 clinical trials. 2 show a significant better. 1 shows a trend. 3 show nothing. So in total, we can say, even in randomized controlled trials, Mistletoe show its effectiveness. Let's look at at one of these trials. Advanced metastatic pancreatic cancer in a randomized clinical trial. And we all know that pancreatic cancer means this is in 99% a palliative situation. And here you can see the group not treated with mistletoe, and here you see the group treated with mistletoe. They significantly live longer. Median overall survival. Now I would like to show why these effects are well tolerable. The therapy is tolerable. No cytochrome P550 induction. This is only shown for Apnova viscum. No effects on pharmacokinetics of gemcitabine or other chemotherapies. No in vitro interactions with trastuzumab or other antibody therapies. This is shown in several literature, and no safety concerns in cohorts with antibody mistletoe combination therapies. So it is shown that there is a positive effect. It is shown that it doesn't hurt first-line therapies with, for instance, gemcitabine or trastuzumab. Mistletoe is part of the integrative medicine. That means it is not against normal, let's say, university medicine. It is helping this medicine. And the indications and the results are enhancing quality of life, immunotherapy for patients, or surgery of risk and of recurrency, and intraperitoneal injections or infusions has a direct anti-cancer effect. What are the specific features of Apnova viscum in comparison to other mistletoe preparations? We have an absolutely elimination of microbial disease. Our active ingredients are not altered by oxidation. Apnova viscum has the highest content of mistletoe lectins and viscotoxins. Apnova viscum has liposomes, and the liposomes are the reason why Apnova viscum is that good tolerable, even of this, if it has this high content of lectins. It is well tolerable because it is closed, the lectins are closed into liposomes, natural liposomes. And these liposomes give the lectins step by step into the body. So there are no bigger side effects than in other preparations. And only for Apnova viscum, it is shown that lectins are available in blood serum. The other preparations do not have so much lectins that you can detect it in the blood. That means Apnova if you give 20 milligrams, still have a cytotoxic effect beside the immune modulation effect. But the immune modulation effect is the main effect which we want to reach if we use mistletoe therapy. How to start treatment? Normally, we start with a dosage of 0.02 milligram for 8 ampoules. And after that, we enlarge the dosage on 0.2 milligram, as well with 8 ampoules. And after that, we go to 2 milligram, and this will be the long-term therapy. The dosage is too high when the local inflammatory at the injection point is bigger than 5 centimeters. So in this case, we should reduce the dosage, or we don't use it 3 times a week. So this was a short introduction into what is Abnova Viscom.